Characteristics of forces causing trauma. To understand the traumatic event, you need to know the direction, speed, and focus of the force. So, forces that cause trauma. That's the direction, the force, contacts to the bone. So there are 5 ways a force can break the bone. Tension is pulling on a bone along the long axis with sufficient energy to cause a break. This can cause dislocations. There's usually no fracture lines, and they're usually caused by an accident. A compression force is pressure pushing down on the bone. This can cause a complete or incomplete fracture. There are usually fracture lines, and you can find these often in the skull, and the actual object can leave an impression in the bone. Torsion is a twisting force, most commonly accidental. It happens when one end is held stationary and the other end is twisted, usually in the long bones. Things such as skiing, falling from a bicycle are common causes. It's not common in homicides or suicides unless it is child abuse. So bending, this is the most common force. Impact is going to be at a right angle to the bone. In subadults, because they're more elastic, it usually causes a green stick fracture where the bone doesn't completely separate. The most common type of bending force for a fracture is a Parry Fracture, where the ulna is actually the bone that wards off the force, either from a blow or from a fall. Shearing force is applied to the side, where one segment of the bone is immobile and then the other part of the bone is actually moved. Again, this is common in accidents and usually results from a fall. Another thing we look at is the speed. So dynamic force is sudden stress. That's force that's going to be delivered powerfully and at high speed. This is the most common type of force that causes a fracture. Static stress is very different in that it's applied very slowly and usually causes a dislocation, but is also the type of force that causes strangulation. So timing of the trauma is also important. So for us, when we're looking at analyzing trauma, antemortem and perimortem trauma are the most important. Postmortem is whatever happens to the body after burial. So the important thing about postmortem is being able to recognize that it is not part of the life history of the individual. So in antemortem trauma, this is trauma before death, where you will have partial or complete healing of the injury. So anytime you have porosity around the break, that means there is bone formation and some time has passed since the trauma and that there is some healing. Once you have actual full-blown healing going on, you will either have rounded edges or remodeling. So this can happen within 1 week of the break. The presence of a bony callus signifies the trauma has healed. So this usually develops at least 6 weeks after injury. So in this photograph, you can see the person on the right has a severe head trauma, which he survived. The fact that the edges are very smooth and that there is some porosity, but most of it is remodeled, shows that this injury actually healed before death. The person on the left, you can see there's an impression in the forehead where there was some sort of trauma, blunt force, pretty high velocity, where it actually indented into the skull and yet has completely healed. So you can see the bumpiness and the porosity where it has tried to remodel. So when we have perimortem trauma occurs around the time of death. So there are no signs of healing. It's going to be a green bone response because it's still covered in soft tissue and fluids. And this type of bone has a lot more flexibility than dried bone. So you're going to see some very distinctive marks on perimortem trauma. So the edges of the trauma will still be sharp. And there's something called hinging, which is very important. That's where the bone has bent away from the direction of the blow, but is still attached. So it's like a hinge. So part of the bone is attached, part of it has broken away. That is because the bone is still moist and it's still trying to stay attached. If this was after death, then it would be dry and it would have just cracked off. Fracture lines are going to only form if the bone is still fresh, so the person is still alive. So again, dry bones don't have fracture lines. And the broken edges are going to be jagged and angled. So in this photograph, these are two separate individuals. You can see along the breakage that there are some, on the left picture, there's some crescent moon-shaped divots. And you can see where the bone has hinged. So it's broken, but it's still attached on one side. And then on the bottom photograph, you can see the radiating lines from the original trauma. So you can see where they were hit multiple times, and you can see radiating lines from the left and the right, which was the bone trying to sort of even out the force as they were being hit. So we're going to go over the types of trauma that you're going to see in archaeological context. So there's blunt force, sharp force, projectile, and also various kinds of miscellaneous trauma. So blunt force trauma. When you have blunt force trauma, you have a blow from something that is either flat or round. There is usually compression, bending, and shearing. There's going to be fracture lines. And blunt object also includes being hit by the floor or something large like a car. So usually blunt weapons, hard surfaces, moving vehicles, these are all considered blunt trauma. In archaeological context, that can include things like horseback riding accidents, clubs, falling from a height, or interpersonal violence. So some visualization of the types of fractures you can see. So a green stick fracture, again, occurs mostly in children because their bones are more flexible. So it's going to be an incomplete fracture. So what that means is the bones don't break and separate into two pieces. It's sort of like a crack. So a lot of this happens closer to the epiphysis in kids. If it does happen in epiphysis, it's very serious. It can actually end up stopping the growth along the bone. A spiral fracture happens when there's torsion. So what happens is there's twisting of the bone. Sometimes that happens if, for instance, the foot is stuck and yet the person rotates around the bone. So that causes a spiral fracture. Comminuted fractures are when the bone is actually, instead of just broken, but crushed into multiple pieces. This is very serious. It causes infection most of the time. Transverse fractures are the most common type. It's just a break straight across. It's the most common that you're going to see. It just happens when something hits the bone at that perpendicular angle. Compound fractures mean the bone has broken through the skin, usually caused by either high velocity or high force. Again, this is very serious and is usually the one that causes infection. So here we have an example of facial trauma. This person was riding on a horse and hit a tree branch. You can see the break is straight across the face. It essentially broke both zygomatic cheekbones, the maxilla, and the nose. It's fully healed, but it obviously altered the look of their face. In this individual, you have what's called a Parry Fracture. It usually happens. They used to think if someone was being hit and they put their arm up to block the blow, but it also happens more commonly, I think, or has been researched, is when someone falls and they just put their hands either in front of them or behind them to stop from falling on their face. Another type of fracture is a compression fracture. Again, this is when the force comes straight down on the bone. You see them in the spine often. For instance, if someone were to fall straight down on their spine, it can cause a compression fracture where some of the vertebrae are actually crushed. And finally, this person suffered extreme blunt force trauma to the side of their face. You can see the eyeball is completely destroyed. The side of the face is destroyed. Part of the ear is destroyed. But then you can see all the bumpy parts show that although there is complete healing, there was probably extensive infection. This person obviously survived what probably was a severe beating. Next, we're going to move to sharp trauma. So sharp trauma is produced by any instrument that has a sharp or pointed edge. You usually see compression and shearing forces that have a narrow focus. These will include punctures and chop marks. So injuries are caused by things such as knives, machetes, axes, hatchets, swords, arrows. So punctures are caused by pointed instruments such as ice picks, knives. They are an indentation at the point of impact. Small bits of bone may break off, and the depth of the wound is based on the force. So fracture lines and hinge fractures may occur. If you have an incision, it's a sharp force drawn across the bone. The force is across the bone and not into the bone. Some bone may peel away, and striations may appear parallel to the cut. Clefts are going to be produced by some heavy, sharp instrument, and it produces a V-shaped notch. There are sometimes radiating lines. Things that produce clefts include things like meat cleavers, machetes, and axes. So here we have an individual with 4 sharp wounds to the forehead. So you can see this individual actually has 10 blows to the head, which usually, to have also blows to the face, means extreme anger or hatred. You're actually trying to obliterate their identity. It's actually unusual to have essentially stab wounds to the face. As you can see there are some radiating fracture lines on the left top wound and on the right top wound and on the right bottom wound. You can see some hinging. Other than that, it's very obvious this person did not survive this attack and probably died pretty much immediately. Next, we have some gladiators. So you can see on the right there are puncture wounds to the skull. There's also cut wounds to the side of the skull and right across the face. This study was interesting in that it was actually able to identify exactly which types of gladiators they were based on what injuries they had and the armor they probably would have worn. So they did a trauma analysis mapping their injuries. There were a lot of sword blows, for instance, to this individual. So that means he's a specific type of fighter in the gladiator arena. We also have a Mongol warrior. You can see in his face that there is an injury to his zygomatic maxilla and nose. So essentially about a quarter of his face has been sliced off. And to the right, you can see his molar has actually shattered. So what happened was he was probably on a horse in battle, and they used a pole axe to knock him off the horse. By falling off the horse, he shattered the molar on the other side of his face. But as you can see, it looks like he probably got up and continued to fight. He survived, and there is infection, and he was brought back from wherever the battle originally was back to Mongolia and buried in Mongolia. So here we also have an amputation. So you can see on the end that it was cut cleanly. You can also see that it is completely healed and actually healed very well. So obviously this implies some sort of medical ability that was pretty high in some past cultures. So next we go on to projectile trauma. So projectile trauma can look like blunt force and sharp force trauma. So projectile trauma just means something impacted the bone with high speed but at a small focus. In modern day, the most common type of projectile trauma is from bullets, but in the past they can be caused by arrows, spears, cannonballs, grenades, or shrapnel. So some of the characteristics are wound beveling. So you're going to have a funnel shape where the object has hit the actual bone. So it'll actually have a funnel shape. Depending on whether it's an exit wound or an entry wound, the funnel will be pointed in a different direction. So the wound shape itself depends on the actual shape of the object, but it also depends on the angle of the trajectory. So the more perpendicular whatever the object is to the bone, the rounder the shape will be. If the shape is oval, that means whatever hit the bone was at a slight angle. And if the bone is actually grazed by whatever the object is, you will actually end up with a large keyhole-shaped wound. So essentially a keyhole-shaped wound is the entry and exit wound at the same time. So you're also going to have fracture lines which are going to radiate from these wounds. And you can also have irregular looking wounds where it looks like the bone has just exploded. So this first individual is a Japanese World War II soldier. He was in one of the caves they were hiding in when the Allies landed. So what you can see is actually a grenade wound. So you can see the funnel beveled shape, one of the original wounds. You can see the radiating fracture lines from the top of the head, and also on the left side of the head there's actually another puncture wound, probably caused by shrapnel bouncing off the inside of the cave. This individual has what's called a keyhole fracture. So you can see the beveling of the edges of the fracture. You can see a little bit of the fracture lines radiating on the left and the right, but you can see the huge size of this wound caused by whatever it was that hit the individual. Instead of going through, it actually traveled around the side, taking off an entire chunk of bone. So again, this is a high velocity injury right to the front of the head, and you can see there are some hinging to the side of the wound, and then you can see the very definite fracture lines going off in 3 separate directions. So this person not only would have been knocked completely backwards by this projectile, pretty much it killed them instantly. So finally, we're going to look at some miscellaneous trauma. So dislocations are also counted as traumas, and that's where the bone has been pulled out of the actual joint capsule. So this can disrupt the cartilage, it can disrupt the blood supply. Most archaeological cultures have treatment for dislocation. So the only time we're going to see one is if they didn't actually correct it and restrain it. So if there are any dislocations that we can see, then that would have meant that they were not able to treat it correctly. And so what happens is usually a false joint is formed where the joint keeps trying to stabilize itself, so it's going to keep adding more bone and more bone until it looks disfigured. So what we have here is actually the hip. So it's a congenital dislocation of the hip bone, and you can see the acetabulum is too shallow. It's not the shape it should be. And to the right, you can see the femur has compensated by adding extra bone. So in the past, dislocations of the shoulder and the hip are probably the two that you will see most common. Another type of trauma is strangulation. Strangulation can be caused by hanging. So this was a type of corporal punishment up until very recently, where you suspend the neck by a cord. Ligature is where you actually tighten something around the neck until someone strangles. And then the third is just manual strangulation, where you squeeze someone's neck with just your hands. So in all 3, you can have breakage of the hyoid, which is the only bone covering the vocal cords in the neck. So usually finding someone with a broken hyoid usually is a signature that they were strangled, whether by hanging, ligature, or manual strangulation. Another type of trauma that you can witness is called trephanation. So trephanation essentially is surgical removal of part of the skull. So this has been practiced all over the world: Greece, Egypt, Iran, the Pacific Islands, all over South America, and has been practiced from at least the Neolithic period, which is probably anywhere from 5,000 to 300 BC, or 3000 BC. So it's thought that usually it was performed after injury to the brain to relieve hematomas and pressures on the brain. So even in ancient times, they knew that there was a need to save someone's life if there was a brain injury, that the brain was going to swell, and they needed to remove all of the swelling. Complications, of course, could be injury to the brain and infection, but in many, many cases, there is actually complete healing of the bone and of the individual. So they seem to have had a lot of knowledge about the meninges and tissues around the brain. Another thing that is a type of trauma is scalping. Scalping also was practiced around the world. It's been recorded in ancient Greece, Central Asia, and North America. So usually you can see the cut marks across this individual, across their forehead. There are several cut marks. There are cut marks at their mastoid process behind their ear, across the back of the head. So this was to take off usually the scalp with the hair. There are various reasons for that. Either it was for trophy taking, but it also could be for memorial taking after a loved one's death. So there were many reasons for it. So it's unusual to find, but when it's found, usually the markings are very distinct. You can also have cultural alterations to the body. So these are also considered types of trauma. Cranial deformation is a very famous one. It's all over the world. It's found in North and South America, Asia, and Europe. The most dramatic cranial deformation, of course, is found in South America, mainly in Peru. So pressure is applied with a cloth or a hard surface for an infant. It usually started around 6 months of age in order to shape the child's skull into a specific shape. Usually the shape can either be more rounded or it can be more flat. There are various reasons why these would have been used. Cranial deformation can either be a symbol of social status, so namely elite social status, or it can also be a way to differentiate between different ethnic groups. So there usually will be, whether it's one or the other, you can usually tell because you look at how many people in the population have it based on how many men and how many women have it, in order to figure out whether it's a socioeconomic marker or an ethnic group marker. But it can also be a socioeconomic and ethnic group marker. So the last type of trauma we're going to just talk about briefly is foot binding. So foot binding was practiced in China up until about 100 years ago, where women's feet were actually crushed and made much smaller, so essentially crippling them so that they couldn't walk very far by themselves. The purpose of this was to make women into like a piece of furniture that made them marriageable. So if they were so delicate and needy, then a husband who could afford a woman like that must be very wealthy and able to take care of her. So it was considered a type of body modification necessary for women to be eligible for marriage. So you can see from the x-ray that the toes are actually bent toward the ankle. It changes the shape of the foot. It changes the actual sole of the foot, essentially making it incredibly difficult for these women to stand or walk long distances. Again, such as cranial deformation, it started in childhood when the feet are still plastic around the ages of 4 or 5 years old. It takes about 2 years for them to mold the feet correctly, and then they essentially have to stay bound for the rest of their life. Otherwise, it causes extreme swelling and pain if they're unwrapped. So, but this was outlawed many, many times, but was difficult to enforce. And in the end, the Communist Revolution, where women had to be able to fight and run and carry rifles, was the end of foot binding, where if you did have daughters with foot binding, you could be put into a concentration camp with your entire family. So that quickly made families stop doing it. So that's the end of trauma.